Well, heartburn is a common ailment, often leaving people looking to the medicine cabinet for relief. While antacids can be a temporary solution, our guest tonight is taking a different approach to treatment, addressing the root cause of the painful problem. MacKenzie is a pharmacist based in Baddeck, Nova Scotia. He joins us now live from our studio in Sydney, and we welcome Graham to CTV News at 5. Thanks for joining us.
Good to be here, Maria.
Well, very first question, I guess, is what causes heartburn and reflux disease?
Well, heartburn is the pain that you experience in the sternum region when you have inflammation caused by regurgitation of acid from the stomach. So it's going the wrong way. And reflux is kind of a broader term. Symptoms of reflux could be heartburn, but it's asthma, ear pain, increased salivation. Patients tend to have a lot of burping after they eat a meal. They feel very full even after a few bites of the meal. And some people just have chronic clearing of their throat and chronic coughs. So heartburn is kind of the symptom, and reflux is the larger disease.
Got it. All right, well, with heartburn, how do you normally treat it? What's the conventional treatment?
Normally we treat heartburn by dealing with the acids. So over the counter we can buy acid neutralizers called antacids, and what we could do is get a blocker which will essentially stop the production of acid from the cells in the stomach. And you can do that either over the counter or prescription wise. And it's quite effective for the heartburn specifically, and for healing ulcers. It's shown that with the right therapy you can heal ulcers within 6 to 8 weeks with this type of medication.
Having said that, you've got a different approach that you employ. How is it different from the traditional treatment?
Well, the sphincter that closes over at the bottom of the esophagus and keeps all the acid down in the stomach is pH dependent. So when you have a lot of acid in your stomach, it's nice and tight. Now as we get older, we produce less and less acid in the stomach, and that tends to relax. And even a small amount of acid coming back into the esophagus will cause heartburn. So what we try to do, and I don't advocate anybody coming off their medications without talking to their doctor or pharmacist, I want to make that clear, but what we try to do is we give betaine hydrochloride, which increases the acid content with each meal. It moves out of the stomach with food. We give probiotics, and we give digestive enzymes. And we gradually try to take people off of their acid blocking drugs. And if you do this too quickly, people that take these kind of medications know that once you stop that medication, if you've been on it a long time, it can really cause a lot of rebound. So we do it very slowly, and we certainly do it with the doctor's blessing. And in talking with some of our naturopath friends, Natasha Turner and Andrea Maxim, we find that this is quite commonly done in their practice, and we've been doing it in ours and finding some good results.
So, well, yeah, so tell me about the results. How do people feel?
Well, almost initially, you'll feel better with your first meal. Once you put acid into the stomach, and you can kind of play around with the dose, we start them with 1 or 2 capsules of betaine hydrochloride with the enzymes. With that first meal, they should feel something. And then down the road, once they get situated on that and they're on the probiotics for their intestinal health, we'll start to take away maybe 1 out of every 3 days. We'll take away their blocker, and then maybe we'll alternate every other day, and finally they'll be off of it totally. And chronic acid suppression is just not something that the body was designed to thrive in. You need acid there, number 1, to digest your food and absorb your nutrients. And number 2, the stomach is one of the first lines of defense against pathogens and microorganisms. So once that's gone, it's kind of a free-for-all in the intestines. That's why we like to replenish that with the probiotics.
Wow.
And we'll probably take away the digestive enzymes. They may or may not be necessary. It's just to give them a boost in the first month.
Yeah, whatever the case, protect it while you can.
Sure.
Sure. Well, thank you so much for joining us from our Sydney studio. MacKenzie is a pharmacist in Baddeck, Nova Scotia. Bruce?